Making headlines, President Donald Trump announcing a new element to his immigration platform last week. People are split on whether it should be implemented. KNWA's Sandra Epperson is in studio to tell us where Arkansans stand on the president's edition of a health care order.
In his latest move on the immigration front, President Trump signed a proclamation to require those seeking to legally immigrate to the U.S. to have health insurance. The move follows a federal injunction on his administration's attempted expansion of the public charge rule.
That rule is set to take effect in early November, and so I can see that being challenged as well.
Aaron Cash is an immigration attorney in Rogers, and he says the health insurance requirement for legal immigrants has a few problems.
You're coming from Europe or South America or Central America. Maybe you haven't had to worry about health insurance before, and now you have to scramble and try to find coverage.
The proclamation, signed by the president Friday, declares the entry of aliens who will financially burden the United States healthcare system is hereby suspended. State Senator Bob Ballinger says the question boils down to whether the government should support those who can't support themselves.
They are absolutely a drain if they come in and we're providing their health care, we're providing their housing, we're providing their food.
Ballinger says most legal immigrants don't fall into that category.
Most of them are coming in, working their heinies off, providing a labor force.
But he wouldn't be shocked to see this experience the same fate as the public charge expansion.
They're using the courts, which happens way too often, to try to exert their policy choice, and not really what the founders envisioned.
Myra Esquivel is a paralegal with Arkansas Immigrant Defense in Springdale, and she says she hopes Ballinger's prediction is correct.
It's discriminatory against the immigrants that are applying for an immigrant visa, and some of them may be low income. It's really unfair.
Esquivel says the plan targets families.
This is going to affect at the micro level with immigrant families. We're talking maybe a U.S. citizen child wants to bring their parents over here, be reunited with them.
And Cash says some things need to be taken into account before implementation.
You may not have a job waiting for you with coverage, and even if you do have a job, there's a waiting period for the coverage to start.
The proclamation says anybody applying for an entry visa has 30 days to show they have health coverage or the money to cover medical costs. Refugees, asylum seekers, unaccompanied minors, and those holding visas before November 3rd would be exempt. In studio, Andrew Epperson, KNWA Northwest Arkansas News.